All of the following are digastric muscles except sternocleidomastoid. So, which are the digastric muscles? Muscle fibers in the ligament of trades, omohyoid, and occipitofrontalis. Tributary of the cavernous sinus include all of the following except deep middle cerebral vein. So, which are the tributaries of cavernous sinus? Superior petrosal sinus, inferior petrosal sinus, and superficial middle cerebral vein. All of the following statement about diploic vein are true except it develops around 8 weeks of gestation. So what is true about diploic vein is these have no valve or are valveless, present in cranial bones, and have a thin wall lined by a single layer of endothelium. Which of the following bones do not contribute to the nasal septum? Lacrimal bone does not contribute to the nasal septum. Sphenoid, palatine, and ethmoid contribute to the nasal septum. Unilateral injury to hypoglossal nerve leads to all except loss of taste sensation in one half of the tongue. So unilateral injury to hypoglossal nerve will lead to hemiatrophy of involved side, deviation of tongue towards the same side, and fasciculation of the tongue, which is not a branch of cavernous part of internal carotid artery, ophthalmic artery. Branches of cavernous part of internal carotid artery are cavernous branch, inferior hypophyseal, and meningeal artery. Larynx has 9 cartilages. All intrinsic muscles of larynx except cricothyroid is supplied by recurrent laryngeal nerve. Cavernous sinus communicates with superior petrosal sinus and inferior petrosal sinus. All are seen in norma basilis except mental foramen. So what is seen in norma basilis is foramen magnum, foramen ovale, and foramen lacerum. The branches of first part of subclavian artery are all except costo-cervical trunk. So the branch of first part of subclavian arteries are vertebral artery, thyrocervical trunk, and internal thoracic artery. One of the following opens in the middle meatus of the nose, maxillary air sinus. The type of joint present between ear ossicle is synovial. Nasal septum is formed by perpendicular plate of ethmoid, vomer, nasal bone, and palatine bone. Structures passing through superior orbital fissure are trochlear nerve, nasociliary nerve, lacrimal nerve, trigeminal nerve, and inferior ophthalmic vein. About lateral pterygoid muscle, which of the following statement is true? It protrudes mandible, arises from infratemporal fossa and lateral pterygoid plate, and it is supplied by facial nerve. Sternocleidomastoid is supplied by all of the following arteries except posterior auricular. So sternocleidomastoid is supplied by occipital, thyrocervical trunk, and superior thyroid. All of the following structures pierce the buccinator muscle except buccal branch of the mandibular nerve. So which structures pierce the buccinator muscle? Parotid duct, molar gland of the cheek, and buccal branch of facial nerve. Middle superior alveolar nerve is a branch of maxillary nerve. The parasympathetic secretomotor fibers to parotid traverse through the following except greater petrosal nerve. The parasympathetic secretomotor fiber to parotid traverse through otic ganglion, tympanic plexus, and auriculotemporal nerve. Which of the following is not true about the trochlear nerve? That it supplies the ipsilateral superior oblique muscle. What is true about trochlear nerve? It has the longest intracranial course and only cranial nerve that arises from the dorsal aspect of the brain stem. Enters orbit through the superior orbital fissure outside the annulus of Zinn. Area that lies immediately lateral to the anterior perforating substance is Lyman insulae. Which of the following cranial structure are insensitive to pain? Choroid plexus is insensitive to pain. All of the following statement about Sternberg canal are true except it is located posterior and lateral to foramen rotundum. What is true about Sternberg canal? Located anterior and medial to foramen rotundum. Represents persistent craniopharyngeal canal and cause of intrasphenoidal meningocele. Structures lying deep to posterior belly of digastric are all except retromandibular vein. So structures lying deep to posterior belly of digastric are hypoglossal nerve, hyoglossus muscle, and occipital artery. Anophthalmosis due to palsy of orbitalis muscle. All are of adult size at birth except maxillary antrum. Which organs are of adult size at birth? Ear ossicle, mastoid antrum, and tympanic cavity. No supply of muscle of soft palate is glossopharyngeal nerve, vagus nerve, and trigeminal nerve. Which of the following is a branch of facial nerve? Chorda tympani, greater petrosal nerve, zygomatic nerve, and nerve to stapedius. Lesser petrosal nerve is not a branch of facial nerve. Muscles supplied by facial nerve are stapedius, risorius, stylohyoid, and platysma. Anterior digastric is not supplied by facial nerve. The supratentorial dura is innervated by the branches of the trigeminal nerve, whereas the infratentorial dura is supplied by branches of the upper cervical spinal nerve and the vagus nerve. The following is true about nasolacrimal duct. It is directed downward, backward, and laterally. Osteomeatal complex refers to maxillary ostium, ethmoidal infundibulum, hiatus semilunaris, and frontal recess. Following is true about safety muscle of tongue, that is innervated by hypoglossal nerve. Lesion of facial nerve above geniculate ganglion is associated with decreased lacrimation. Inferior oblique muscle of eye is supplied by oculomotor nerve. Abductor of vocal cord is lateral cricoarytenoid. All of the following have no lymphatic except liver. So liver has lymphatic, but brain, internal ear, and cornea does not have any lymphatic. All of the following are seen in the Horner syndrome except dilated pupil. So what is seen in Horner syndrome? Drooping of upper eyelid, anophthalmos, and loss of sweating on same side of face, that is ptosis, anophthalmos, and anhidrosis. All of the following are contents of suboccipital triangle except occipital artery. So the content of suboccipital triangle are vertebral artery, dorsal ramus of C1 nerve, suboccipital plexus of vein. Facial nerve supplies risorius, zygomaticus, and auricular muscles. About otic ganglion, true statement is lesser petrosal nerve forms parasympathetic root, secretomotor to parotid gland, nerve to medial pterygoid connected to the ganglion. True about vertebral artery, it is a branch of subclavian artery and it passes through foramen transverse areum of cervical vertebrae. Nerve supply of the muscle of palate is glossopharyngeal nerve, vagus nerve, trigeminal nerve, and greater palatine nerve. All are true except thyroidea ema artery is invariably a branch of arch of aorta. So what is true about superior thyroid artery is a branch of external carotid artery. Posterior branch of superior thyroid artery supplies parathyroid gland. Inferior thyroid artery is a branch of thyrocervical trunk. In the ductal coarctation of the aorta, blood flow to the lower limb is maintained through which of the following arteries? Vertebral artery. Extrinsic muscle of larynx are all except cricothyroid. Extrinsic membrane of larynx include thyrohyoid, hyoepiglottic, and cricotracheal. Cranial nerve not carrying parasympathetic fiber is fourth cranial nerve. Middle superior alveolar nerve is a branch of none of these options. Anterior ethmoidal nerve supplies all except maxillary sinus, so it supplies interior of nasal cavity, dural sheath of anterior cranial fossa, and ethmoidal air cells. The function of eighth cranial nerve is related to balance. Which of the following passes through the foramen magnum? Vertebral artery. Pain in the posterior 1/3 tongue after tonsillectomy is due to injury of ninth nerve. Damage to the external laryngeal nerve results in loss of timbre of voice. Alderman's nerve is a branch of auricular branch of vagus nerve. Which of the following arteries supply blood to trigeminal ganglion, cavernous part of internal artery? The abductor of vocal cord is posterior cricoarytenoid. Anterior triangle of neck are submental triangle, carotid triangle, supraclavicular triangle, and muscular triangle. Digastric triangle is not included in anterior triangle. Blood supply of facial nerve is ascending pharyngeal artery, middle meningeal artery, and stylomastoid branch of occipital artery. False statement about trigeminal nerve, that it arises from C8 nerve root. What is true about trigeminal nerve? It carries sensation from face and scalp. It has a motor branch. and it is composed of spinal nucleus. Tensor tympani is supplied by trigeminal nerve. All of the following are true about scalenus anterior muscle. It separates the subclavian vein from the subclavian artery. Lacrimation is lost in lesion of greater petrosal nerve. In a subclavian artery block at outer border of the first rib, all of the following arteries help in maintaining the circulation to the upper limb except vertical crest and fundus of the internal auditory canal is known as trochlear nerve. All is true except that it supplies ipsilateral superior oblique muscle. What is true about trochlear nerve? Longest intracranial course. It arises from dorsum of brainstem and enters orbit through superior orbital fissure outside annulus of Zinn. Sternocleidomastoid is supplied by all of the following arteries except posterior auricular. So sternocleidomastoid is supplied by occipital, thyrocervical trunk and superior thyroid. The bifurcation of common carotid occurs at upper border of thyroid cartilage. Which of the following is not supplied by the anterior division of mandibular nerve? Medial pterygoid. Which of the following passes through the foramen magnum? Vertebral artery. All are elevators of mandible except digastric. So which are the elevators of mandible? Temporalis, medial pterygoid and masseter. Anterior two-thirds of tongue develops from first branchial arch. Nerve supply of pinna is all except greater superficial petrosal nerve. So which nerve supply pinna? Greater auricular nerve and auriculotemporal nerve and lesser occipital nerve. Spinal cord end at which level in infant? L3. All muscle of tongue are supplied by hypoglossal nerve except palatoglossus muscle. So hypoglossal nerve supplies genioglossus, hypoglossus and styloglossus but not palatoglossus. Structure which passes through the internal auditory meatus are all except anterior inferior cerebellar artery. So which structure pass through the internal auditory meatus? Nerve of Risberg, superior vestibular nerve and cochlear nerve. Laryngeal prominence is formed by angle of the thyroid cartilage, which is not a branch of facial nerve. Greater petrosal nerve is not a branch of facial nerve. Which are the branches of facial nerve? Branch to stylohyoid muscle, chorda tympani nerve and lingual nerve. True statement regarding central retinal artery is that it is a branch of ciliary artery. One of the following bone is absent in newborn is temporal bone. Which bones are present in newborn? Incus, stapes and malleus are present in newborn. Structure not enclosed by carotid sheath, cervical sympathetic chain. So structures enclosed by carotid sheath are internal carotid artery, vagus nerve and internal jugular vein. Which is not a branch of ophthalmic artery? Superficial temporal artery is not a branch of ophthalmic artery. The branches of ophthalmic artery are dorsal nasal artery, superior orbital artery and supratrochlear artery. Sinus overlying fox cerebelli is occipital sinus. Ansa cervicalis supplies sternohyoid. Oculomotor nerve supplies all except lateral rectus. So oculomotor nerve supplies medial rectus, inferior rectus and superior rectus. In adults, spinal cord end at lower border of L1. The muscle stylopharyngeus is supplied by which nerve? Glossopharyngeal. Preganglionic fiber to the submandibular ganglion arise from superior salivatory nucleus. Sensory supply to tonsil is by which nerve? Glossopharyngeal nerve. What is the blood supply of the cervical esophagus? Inferior thyroid artery. What overlies the lateral wall of the mastoid antrum? Suprameatal triangle. Which of the following is supplied by the third cranial nerve? Inferior oblique. What do the semicircular canals detect? Angular acceleration. Inferior thyroid vein drains into brachiocephalic vein. Primary action of superior oblique is intorsion. What is true about chorda tympani? Preganglionic parasympathetic. Blood supply of the eustachian tube is by all except facial artery. So the blood supply of eustachian tube is by ascending pharyngeal artery, middle meningeal artery and artery of pterygoid canal. Bed of tonsil is formed by superior constrictor. True regarding surface anatomy of internal jugular vein. Line passing from ear lobule to medial end of clavicle. Caisal back plexus is present at antero-inferior part of nasal septum. Cricoid cartilage lies at which vertebral level? C6.